The effect of antithrombotic treatment on the fecal immunochemical test for colorectal cancer screening, a nationwide cross-sectional study. Introduction. Colorectal cancer, CRC, is the second leading cause of cancer-related deaths in the Western world. Early diagnosis is paramount to ensure the survival of CRC patients, with two main screening strategies being used: sigmoidoscopy and fecal occult blood testing. A Cochrane meta-analysis concluded that both methods reduce CRC-specific mortality, promoting the use of either of the two methods. In addition, opportunistic screening with colonoscopy is widely adopted in many high-income countries, particularly in the United States. The number of people treated with anticoagulant or antiplatelet drugs, antithrombotics, is increasing. Treatment options have evolved during the last decades from mainly acetylsalicylic acid and vitamin K antagonists to include more potent antiplatelet drugs and non-vitamin K oral anticoagulants. Studies evaluating the effect of antithrombotic treatment on CRC screening have primarily focused on the guaiac-based fecal occult blood test. The guaiac-based fecal occult blood test is based on the peroxidase activity of heme, and test results are affected by antithrombotic treatment to such a degree that discontinuation is recommended prior to screening. In Denmark and many other European countries, the preferred screening modality has been the fecal immunochemical test, FIT. This preference for FIT over guaiac-based fecal occult blood test is because of its increased sensitivity and specificity, better patient compliance, the lack of dietary restrictions, and, importantly, the ability to continue antithrombotic treatment during testing. The impact of antithrombotic treatment on the efficacy of FIT for CRC detection has been sparsely evaluated. The studies have been limited by a relatively low number of participants, and they were most often conducted in an opportunistic screening setting. Therefore, the effects of antithrombotic treatment on FIT-based CRC screening are still under debate and demand further investigation. The authors aimed to 1. Assess the effect of any type of antithrombotic treatment on FIT values and FIT positivity. 2. Evaluate the impact on the positive predictive value according to the results from the follow-up colonoscopy. And 3. Assess if antithrombotic treatment affected the adherence to the follow-up colonoscopy after a positive FIT. Background. Screening for colorectal cancer, CRC, using the fecal immunochemical test, FIT, has been widely adopted. The use of antithrombotic treatment is increasing in the Western world. This study aimed to assess the effects of antithrombotic treatment on the FIT-based Danish National Screening Program for CRC. Methods. This was a cross-sectional study of all individuals returning a FIT from 2014 until 2016. The effect of antithrombotic treatment on FIT positivity and the positive predictive value were assessed using proportions and multivariable Poisson regression. Results. Of 884,036 invited individuals, the authors identified 551,570 participants. A positive FIT was observed in 9,052 of 77,007 individuals, 11.8%, receiving antithrombotic treatment, compared with 28,387 of 474,587 individuals, 6.0%, receiving no treatment. The adjusted relative risk, RR, for a positive FIT was 1.59 for any treatment. Non-vitamin K oral anticoagulants were associated with the largest increase in FIT positivity adjusted relative risk 2.40. The proportion of CRC detected at colonoscopy was slightly lower among patients on antithrombotic treatment than among treatment-naive patients. The positive predicted value for CRC or high-risk adenomas was decreased nearly twofold in patients treated with non-vitamin K oral anticoagulants, adjusted relative risk 0.58. Conclusion. Antithrombotic treatment was associated with a decreased positive predictive value in FIT-based CRC screening.